name is Dr. Vera Tarman, and I'm an addictions physician working out of Toronto, Canada. And today I want to talk about wet brain. What is wet brain? And in general, what is alcohol dementia? So as you can probably imagine, wet brain is not actually a medical term. It's a term that the public uses usually to describe alcohol dementia, somebody who has been drinking for many, many years, possibly on a daily basis, and eventually their cognitive status becomes impaired as they get older. And when I mean older, I mean like even after age 60. I'm not talking about 80, 90 onwards. It can be even after the age of 60. And in fact, wet brain can happen even as a young person, but just that's generally what people mean when they say wet brain. That actually is a term that stands for Wernicke's-Korsakoff syndrome. It's actually quite rare. It's not that common, but because it can happen, it's in a sense considered an acute dementia. It can happen quite quickly, even to a young person. And so it's something that an emergency physician is always alert for. It's actually quite preventable once you know what it is. Wet brain, or Wernicke's-Korsakoff syndrome, is actually a nutritional deficiency. It's a cause of a nutritional deficiency. And what happens is that a person, when they're drinking a fair amount, alcohol affects the body in many ways. It affects the brain, as we're talking about today. It affects the gut, our stomach. It affects our blood system, it affects our liver, it affects all parts of the body. And so specifically, in the case of Wernicke's-Korsakoff, it affects the stomach lining, because when you're drinking alcohol, it's corrosive, you've got acid in the stomach already, now you're including alcohol. Ultimately, you get what's called gastritis or even a gastric ulcer. And as part of the effect of that gastritis, gradual eroding of the stomach lining, is that the stomach lining is no longer able to do its job. It does a certain amount of absorption of essential vitamins and foods. Most of our foods are absorbed in the duodenum, which is the small intestine, but some of it is absorbed in the stomach. And when the stomach is being eroded, it's not doing its job. And there's a key vitamin that the stomach must absorb, and that's called vitamin B1. And anybody who has been to an emergency hospital because of an alcohol overdose or suspected alcohol overdose, they should always be alert. Could there be a vitamin B1 deficiency happening? Vitamin B1 is thiamine, and anybody who's been to the hospital will know that they've received a thiamine injection, or they've received a script for thiamine pills for the next 1 or 2 weeks. Often you take it in detox. If you don't have the thiamine, either through immediate injection or through diet, and thiamine can be found in many, many foods. But what is the alcoholic doing? They're not eating usually, and they're also not absorbing the thiamine even if they do eat. So they're low on thiamine. And one of the things that we know is that without thiamine, in the context of sugar, and what is alcohol but fermented sugar, a lot of sugar, you have a lot of sugar, low thiamine, and you get this combination that leads to Wernicke's-Korsakoff, which is an immediate form of memory loss. And it's the type of memory loss where the person actually doesn't realize necessarily that they have memory loss. They'll actually do what we call confabulation. They know one thing and they know another, but they don't know how one led to the other. And so they'll make up a story. Like, I will confabulate. Essentially, I'll lie. Like, for example, often think of is if you ask somebody, what did you have for breakfast? And they don't actually know, but so they'll just make up something. They don't even know they're making it up. They're just making it up. And they'll say eggs and bacon. And if you say, but how could you have eggs and bacon? There was no eggs and bacon in the fridge today. Then they'll make up, well, I actually had some in my purse from the day before, or my backpack. And you say, well, you weren't out the day before. And you say, well, actually, it was kind of old. Like, they'll make up some story. It's confabulation. And so it's memory loss with this confabulation piece to it. That's typical of Wernicke's-Korsakoff. And another feature of Wernicke's-Korsakoff that also potentially, if you don't get your thiamine, Wernicke's eventually then becomes Korsakoff syndrome, which is a long-term dementia. So you want to get that thiamine. But the other thing is you have low memory and you have very strong instability. The cerebellum, which is at the back of the head, that governs my ability to not walk, but coordinate my walking so I can walk in a straight line. That's why when you go to see the physician, they'll actually ask you to walk a straight line. And if you can't walk a straight line, we know that it's your cerebellum that's been affected. that happens also with Wernicke. So you get the unsteady gait, we call it, and you get this confabulation memory loss. And then also one other thing that you get is you get your eye jiggles. So that if you're in the examining room, the doctor will say, follow my finger with your eye. And if your eyeball is actually jiggling, that's actually a third sign. And that's a sign of Wernicke's. And you better get your thiamine, because if you don't, Korsakoff syndrome ends, and then you have the unsteadiness forever and the memory loss forever. But it's very preventable, and that's by giving a shot of thiamine. So that's the acute form of alcohol dementia. Then the second form, the long-term form, aside from, I guess, Korsakoff's, if you didn't get your thiamine in time, would be basically multi-infarct dementia. We have other types of dementia. We have Alzheimer's dementia. The most common second cause is what's called multi-infarct dementia. A multi-infarct dementia is multiple strokes in the brain. And you may not notice, it's not, in a sense, it's like Alzheimer's. It's not like a big stroke where all of a sudden you're there and then you have sudden loss on one side of your body. You can't move your face, you can't move your arm. It's multiple little strokes. So it'll happen, the stroke will happen in one part of the brain one day, and then maybe a few weeks later, a month later, it's in another part of the brain, and then in another part of the brain. And over time, it's like multi-steps downwards, so that you don't notice it, and maybe your family doesn't notice it, who lives with you, but somebody who hasn't seen you for 3 months will go, whoa, that person is not connecting dots. There's something going on there. So that's a sign of this sort of gradual, slow dementia that is a bit like Alzheimer's, which is also a gradual, slow dementia, but it's a different mechanism. It's caused by multiple little strokes to the brain. So you've got the strokes to the brain. What's the cause? It's like little blood clots over time that, happen. And why does that happen? Because alcohol, like I said, it affects so much of the body. It affects the brain, the liver, it affects everything, really. And one of the things it definitely affects fats, what we call triglycerides and cholesterol, go up because of alcohol use. And when you have cholesterol in the blood, that's particularly the bad cholesterol and clots that are forming, you essentially get an immune response. You get plaques, and then there's crusty little bits, like you can see in the diagram behind me, in the vessel, and then they pluck off from the areas where there's a lot of activity. That's typically around the heart and around here in the carotid arteries, we call it. And then a little piece will split off there, and then go off into, it's like there's the trunks of the branch of the tree here, and it breaks off into multiple little branches, and then that big clot will go and get stuck there, and then another clot will go and get stuck there, and then there, and this gradual process. It's not one massive stroke, but many little strokes. Multi-infarct dementia, that's very common with alcohol use as well. And those are the kind of two main types of alcohol dementia. The question would be, well, how can I avoid this? Well, obviously, the best way is to cut down on your alcohol use, because it's dose dependent. The more you drink, the more likely you're going to erode your stomach, then you're not going to be able to absorb thiamine and other essential nutrients. So cutting down the alcohol is a key piece. Another piece is you want to eat well. And often what happens when people are drinking in a problematic way is they're not eating and they're not getting their thiamine. And if you're in detox and you decided, okay, I'm going to eat well, I'm going to stop drinking, get your thiamine shot. And it's expensive, it hurts, but it's essential. If you're in a position where there's any question that you might have wet brain, or that you were exposed to that possibility, limit your alcohol intake and seek help, because it is possible to stop drinking. And if you have any signs of this, that's an indication that it is time to stop drinking. And you can stop. It doesn't have to get worse than it is. And in fact, it can often get better.